Hello everyone, today I want to talk about something that's both widely consumed and widely misunderstood: alcohol. More specifically, what alcohol actually does to your body, your brain, and your long-term health. This isn't a moral conversation, it's a scientific one. We're going to focus on 5 key effects that alcohol has, physiologically and neurologically, based on peer-reviewed research and clinical evidence. Some of this might surprise you, some of it might confirm what you already know. But either way, this is information I believe everyone should be aware of, whether you drink or not. Alcohol is fundamentally a toxin, and more specifically, it's classified as a neurotoxin. That means it's a substance that damages nerve cells, including those in your brain. When you consume alcohol, it doesn't just alter your mood or behavior temporarily. It actually changes the structure and function of your brain at a cellular level. This is critical to understand because the brain is the control center for everything you do: thinking, moving, feeling, and even regulating your internal bodily processes. When alcohol enters your bloodstream, it easily crosses the blood-brain barrier. This barrier is designed to protect the brain from many harmful substances, but alcohol is small and fat, soluble, so it penetrates this protective shield with ease. Once inside your brain, alcohol interacts with neurons in a way that is fundamentally disruptive. It affects the membranes of neurons, which are critical for communication between cells. These membranes contain receptors and ion channels that regulate the flow of electrical signals, and alcohol interferes with these processes. This interference can cause neurons to malfunction or even die. One of the key effects of alcohol is on the brain's gray matter. Gray matter consists largely of the cell bodies of neurons, which process and interpret information. Research using brain imaging techniques such as MRI shows that even moderate alcohol consumption can lead to a reduction in gray matter volume. This shrinkage is especially evident in areas like the prefrontal cortex, which is responsible for decision making, impulse control, and executive function, and the hippocampus, which plays a crucial role in memory formation. The reduction in gray matter can impair your ability to think clearly, control impulses, and store new memories. Alcohol's neurotoxic effects are dose-dependent but don't require heavy drinking to occur. Studies reveal that even low to moderate consumption, just a few drinks per week, can negatively impact brain structure and function. This contradicts the popular belief that moderate drinking is harmless or even beneficial. The idea that a little wine is good for your heart is nuanced. While some antioxidants in wine have health benefits, the alcohol itself remains harmful to your brain cells. At the cellular level, alcohol generates oxidative stress. Oxidative stress is a condition where there is an imbalance between free radicals, unstable molecules that can damage cells, and the body's ability to neutralize them with antioxidants. When neurons experience oxidative stress, their DNA, proteins, and membranes become damaged. Over time, this damage accumulates, leading to neuronal dysfunction and death. The brain has some capacity to repair itself, but chronic alcohol exposure overwhelms these repair mechanisms. Another important factor is neuroinflammation. Alcohol activates the brain's immune cells called microglia, which respond to injury or infection by producing inflammatory molecules. While inflammation is a natural part of healing, excessive neuroinflammation can harm neurons and disrupt neural circuits. This contributes to cognitive decline and mental health issues often observed in people who consume alcohol regularly. Alcohol also affects neurogenesis, the process by which new neurons are formed, particularly in the hippocampus. Neurogenesis is vital for learning, memory, and mood regulation. Alcohol suppresses neurogenesis, which can lead to memory problems and mood disorders like depression and anxiety. This suppression makes it harder for the brain to adapt and recover from damage. When you consider the functional effects, it becomes clear how alcohol's neurotoxicity manifests in everyday life. After drinking, many people experience impaired judgment, slowed reaction time, memory lapses, and difficulty focusing. These acute effects result from the disruption of normal neuronal signaling. But with repeated use, these impairments can become more persistent and can contribute to long-term cognitive decline. It's also important to consider that developing brains, such as those of adolescents and young adults, are particularly vulnerable to alcohol's toxic effects. The brain continues to mature well into the mid-20s, and alcohol exposure during this period can interfere with critical developmental processes, leading to lasting deficits in cognition, emotional regulation, and impulse control. Finally, alcohol's neurotoxicity contributes to addiction. By altering the brain's reward circuitry, specifically the dopamine system, alcohol creates patterns of dependence. The brain learns to crave the substance despite its harmful effects because the immediate chemical reward outweighs the long-term damage. This cycle of craving and consumption further exposes the brain to neurotoxic damage. Understanding alcohol as a neurotox shifts the conversation away from cultural attitudes that often minimize its dangers. It reframes alcohol use as a biological insult to the brain and nervous system, not merely a lifestyle choice. This perspective empowers you to make more informed decisions about consumption, recognizing that every drink has consequences at the cellular level. In summary, alcohol is a powerful neurotoxin that crosses into the brain and damages neurons through multiple mechanisms, disrupting membrane function, shrinking gray matter, inducing oxidative stress and neuroinflammation, suppressing neurogenesis, and altering brain circuitry. These effects impair cognition, memory, emotional regulation, and increase the risk of addiction. Knowing this helps you weigh the true cost of alcohol on your brain health, not just in the moment, but over a lifetime. When you drink alcohol, one of the first things that happens in your brain is a profound disruption of its delicate chemical balance. The brain relies on a complex interplay of neurotransmitters, chemical messengers that allow neurons to communicate. Two of the most critical neurotransmitters affected by alcohol are GABA-gamma-aminobutyric acid and glutamate. These two function almost like a yin and yang for brain activity. GABA inhibits neural firing and promotes calm and relaxation, while glutamate excites neurons and supports alertness, learning, and memory. Alcohol's impact on these systems is at the core of why you feel relaxed, less anxious, or even euphoric after a few drinks, and why later you might feel anxious, foggy, or irritable. Alcohol acts primarily as a potent enhancer of GABA activity. GABA is the brain's main inhibitory neurotransmitter. It acts like a brake on neural circuits, slowing down brain activity. When alcohol enhances GABA, it increases inhibition, which creates that initial calming, anxiolytic effect. This is why alcohol can make social anxiety fade, help people relax, and promote feelings of sedation or mild euphoria. The increase in GABA activity also suppresses many brain functions that contribute to self-control, judgment, and reaction time. That's why even moderate drinking can impair decision-making and coordination. At the same time, alcohol suppresses the activity of glutamate, the brain's primary excitatory neurotransmitter. Glutamate is responsible for driving neuronal firing and supporting cognitive functions such as attention, learning, and memory formation. By reducing glutamate's excitatory effects, alcohol dampens brain activity further, contributing to slowed reaction times and cognitive impairment. This suppression is part of why you might experience memory lapses or the infamous blackouts during heavy drinking episodes. But what's critical to understand, and what is less obvious, is that this imbalance created by alcohol is temporary. The brain is constantly striving to maintain homeostasis, a stable internal environment. So when alcohol pushes GABA activity up and glutamate down, the brain compensates by adjusting receptor sensitivity and production. Over time, with continued alcohol exposure, the brain reduces the sensitivity of GABA receptors and increases the number or activity of glutamate receptors to counteract the depressant effects of alcohol. When the alcohol wears off, this compensatory change leaves the brain in a hyper-excitable state. Suddenly, the inhibitory influence of GABA is reduced, and excitatory glutamate activity rebounds sharply. This is why people often experience symptoms like anxiety, restlessness, irritability, and trouble sleeping after drinking. The brain is effectively going through a mini withdrawal even after just one night of drinking. This state is commonly called the rebound effect, and it's a biological explanation for why people may feel worse after alcohol leaves their system than before they drank. This rebound state also severely disrupts sleep architecture. Alcohol might help you fall asleep faster initially because of the heightened GABA activity, but the glutamate rebound leads to fragmented, poor-quality sleep, especially in the rapid eye movement REM phase, which is crucial for memory consolidation and emotional regulation. The result is non-restorative sleep, which leaves you feeling groggy and cognitively impaired the next day. This poor sleep quality contributes to the hangover fog and also can exacerbate feelings of anxiety or depression. The neurotransmitter disruption caused by alcohol isn't limited to GABA and glutamate. Alcohol also influences dopamine, the brain's reward chemical, and serotonin, which modulates mood. Dopamine release increases during drinking, contributing to the pleasurable sensations and reinforcing alcohol use behavior. However, repeated alcohol exposure can blunt dopamine signaling over time, making it harder to feel pleasure from natural rewards and potentially driving addictive patterns. Similarly, serotonin modulation by alcohol can influence mood and anxiety, sometimes resulting in transient mood elevation, but also potentially increasing depression and anxiety symptoms during withdrawal. In the long term, the persistent disruption of neurotransmitter balance contributes to the cognitive and emotional problems seen in chronic drinkers. The brain's constant need to adjust its chemistry in response to alcohol leads to structural changes, neurotoxicity, and impaired neural plasticity, the brain's ability to adapt and learn. This can result in persistent anxiety, memory deficits, emotional dysregulation, and increased risk of addiction. What is often misunderstood is that these neurochemical changes are not limited to heavy drinkers. Even moderate alcohol consumption can temporarily alter neurotransmitter function enough to disrupt your mood, cognition, and sleep quality. This explains why many people feel anxiety or brain fog the day after drinking, even if they didn't drink to excess. The brain's chemistry takes hours to rebalance, and during that time, you experience the effects of this chemical roller coaster. Understanding alcohol's effects on neurotransmitters also empowers you to seek alternatives for managing stress, social anxiety, or mood. Practices such as controlled breathing, meditation, physical exercise, and cold exposure can naturally enhance GABA signaling and promote dopamine release without the damaging effects of alcohol. These methods help train your nervous system toward resilience and balance, rather than forcing it into a harmful cycle of artificial chemical manipulation. In summary, alcohol profoundly disrupts your brain's chemical balance by increasing inhibitory GABA signaling and suppressing excitatory glutamate activity. While this creates temporary relaxation and euphoria, the brain's compensatory responses lead to a rebound state characterized by anxiety, poor sleep, and cognitive impairment once the alcohol leaves your system. This neurochemical disruption affects not only immediate mood and function, but also long-term brain health, cognitive ability, and emotional regulation. Recognizing these effects provides a clearer understanding of why alcohol impacts us as it does, and why healthier alternatives for managing stress and social connection exist. Sleep is one of the most essential processes for our brain and body to function optimally. Yet alcohol, despite its common use as a sleep aid, profoundly disrupts sleep quality in ways that are often overlooked or misunderstood. While many people reach for a drink to help them fall asleep faster, the impact of alcohol on the actual architecture of sleep reveals a very different story, one that explains why so many people wake up feeling tired, groggy, or mentally foggy after a night of drinking. When you consume alcohol, it acts as a sedative initially, speeding up the time it takes to fall asleep. This is because alcohol enhances GABA activity in the brain, the primary inhibitory neurotransmitter that promotes calm and relaxation. As a result, It's easy to mistake this sedative effect as alcohol being beneficial for sleep. However, the story gets more complicated once alcohol begins to be metabolized and its levels in the bloodstream decline. Sleep is composed of different stages, cycling throughout the night in roughly 90-minute intervals. These stages include light sleep, deep slow-wave sleep (SWS), and rapid eye movement (REM) sleep. Each stage plays a crucial role. Deep sleep is important for physical restoration, immune function, and clearing metabolic waste from the brain, while REM sleep supports memory consolidation, emotional regulation, and creativity. Alcohol disrupts this natural cycling by suppressing REM sleep during the first half of the night. REM sleep is when most dreaming occurs and is critical for cognitive and emotional health. When REM is suppressed, the brain's ability to process emotions and consolidate memories is compromised. This leads to cognitive impairments and emotional volatility the next day. People often notice this as feeling off or emotionally unstable after drinking. As alcohol is metabolized and cleared from the body, a rebound effect occurs, leading to fragmented and restless sleep in the second half of the night. This rebound is characterized by frequent awakenings and difficulty returning to sleep. Because deep sleep tends to be consolidated in the early part of the night, the combination of REM suppression and sleep fragmentation means that overall sleep quality is significantly reduced, even if the total hours spent in bed remain the same. In practical terms, this means that even though you may have technically slept for 7 or 8 hours, the restorative value of that sleep is diminished. The brain doesn't undergo its normal processes of repair and memory processing effectively. This is one reason why the morning after drinking can feel so difficult. You are essentially waking up in a state of sleep deprivation without having consciously lost any sleep time. The consequences of poor sleep quality extend far beyond just feeling tired. Chronic disruption of sleep architecture is linked to impaired immune function, increased inflammation, decreased cognitive performance, and heightened risk for mood disorders such as anxiety and depression. It also negatively impacts learning, creativity, and decision making. Over time, repeated alcohol use before bedtime can lead to a vicious cycle. Poor sleep increases stress and anxiety, which some may attempt to self-medicate with more alcohol, further worsening sleep. Interestingly, the disruption in sleep caused by alcohol is not limited to heavy drinkers or those with alcohol use disorder. Even moderate consumption, such as 1 or 2 drinks in the evening, can reduce REM sleep and cause sleep fragmentation. This is critical to understand because it challenges the common perception that moderate drinking is harmless or even beneficial for relaxation and sleep. For individuals who already struggle with insomnia or poor sleep, alcohol can initially seem to help because of its sedative effect. But this is misleading. The suppression of REM and fragmented sleep later in the night actually exacerbates these problems, reducing overall sleep quality and making it harder to feel rested. On a neurochemical level, alcohol-induced changes in GABA and glutamate activity contribute to sleep disruption. While GABA activity is initially enhanced, promoting sedation, the brain compensates by increasing glutamate activity later on, leading to increased neuronal excitability and sleep fragmentation. This fluctuating balance between inhibitory and excitatory signaling creates the disrupted sleep patterns often observed after drinking. It's also important to consider the effect of alcohol on the circadian system, the internal biological clock that regulates sleep, wake cycles, and many other physiological processes. Alcohol can alter circadian rhythms, leading to misalignment between your internal clock and the external environment. This misalignment can further impair sleep quality and daytime alertness. Fortunately, the negative effects of alcohol on sleep are reversible. If alcohol consumption is reduced or eliminated, sleep architecture typically normalizes within days to weeks, depending on the individual and the extent of prior alcohol use. Restoring healthy sleep patterns is crucial for brain repair, emotional balance, and overall health. For those looking to improve sleep without alcohol, there are better strategies that promote natural, restorative sleep. These include maintaining a consistent sleep schedule, optimizing light exposure during the day, and reducing light exposure at night, practicing relaxation techniques like deep breathing, meditation, and creating a sleep-friendly environment free of noise and distractions. In summary, while alcohol might seem to help you fall asleep faster, it disrupts the critical stages of sleep that your brain needs to repair and rejuvenate itself. By suppressing REM sleep and causing fragmented sleep later in the night, alcohol reduces the overall quality of your sleep. This leads to impaired cognitive function, emotional instability, and a greater risk of chronic health problems. Understanding these effects provides insight into why sleep after drinking often feels unrefreshing and underscores the importance of healthier sleep habits for long-term brain and body health. Alcohol's effects on the body extend far beyond its immediate impact on the brain and nervous system. It also has profound influences on your hormonal health. Hormones are chemical messengers that regulate virtually every physiological process: growth, metabolism, reproduction, stress response, and more. When you consume alcohol, you disrupt the finely tuned hormonal balance in ways that can affect your energy, mood, physical health, and even your fertility. One of the most well-studied hormonal effects of alcohol is its impact on sex hormones, particularly testosterone and estrogen. Testosterone, often thought of as a male hormone but also present in females, plays a critical role in muscle mass, energy levels, libido, mood, and cognitive function. Alcohol consumption, even in moderate amounts, suppresses testosterone production in the testes and adrenal glands. This suppression happens through multiple mechanisms, including direct toxic effects on Leydig cells, the cells responsible for producing testosterone, and disruption of the signaling pathways in the brain that regulate hormone release. As testosterone levels decline, men may experience reduced libido, decreased muscle mass, increased body fat, fatigue, and impaired mood. These changes can accumulate over time, leading to long-term health consequences like decreased bone density and metabolic dysfunction. It's worth noting that these hormonal shifts are not restricted to chronic heavy drinkers. Even moderate alcohol intake can transiently lower testosterone levels, which may have meaningful effects over weeks or months. In women, alcohol influences estrogen levels, typically causing them to rise. While estrogen is vital for female reproductive health, bone maintenance, and cardiovascular function, elevated estrogen levels caused by alcohol can have negative consequences. Increased estrogen is associated with a heightened risk of breast cancer, as estrogen can promote the growth of hormone-sensitive cancer cells. Alcohol's ability to increase circulating estrogen, combined with its direct cellular toxicity, contributes to this increased cancer risk. Moreover, alcohol disrupts the menstrual cycle and ovulation, potentially impairing fertility. It interferes with the hypothalamic, pituitary, gonadal HPG axis, the hormonal system that regulates reproduction. This can lead to irregular periods, anovulation, lack of ovulation, and reduced fertility. For women trying to conceive or maintain reproductive health, alcohol represents a significant hormonal disruptor. Beyond sex hormones, alcohol also impacts the stress hormone, cortisol. Cortisol is produced by the adrenal glands and is essential for regulating metabolism, immune function, and the body's response to stress. However, when cortisol is chronically elevated, it can lead to insulin resistance, muscle breakdown, immune suppression, and abdominal fat accumulation. Alcohol consumption initially suppresses cortisol release, but is followed by a rebound increase in cortisol levels several hours later, especially during withdrawal or hangover periods. This spike in cortisol contributes to feelings of anxiety, irritability, and metabolic imbalance after drinking. The dysregulation of cortisol and sex hormones together creates a hormonal environment that promotes fat storage, muscle loss, poor mood, and impaired recovery from stress. This environment makes it harder to maintain a healthy weight, build muscle, or recover from physical and mental stressors. Alcohol's interference with hormones also affects thyroid function. The thyroid gland produces hormones that regulate metabolism, energy levels, and body temperature. Chronic alcohol use can reduce thyroid hormone production or impair its activation in the body. This can lead to symptoms of hypothyroidism, fatigue, weight gain, cold intolerance, and cognitive slowing, which further compounds the lethargy and cognitive fog often reported after drinking. Fertility is another area heavily impacted by alcohol's hormonal disruption. In both men and women, alcohol can reduce sperm count and quality, alter sperm motility, and impair the hormonal signals needed for healthy reproductive function. For women, alcohol can interfere with egg quality and disrupt the hormonal cycles required for conception. This makes alcohol a significant factor to consider for anyone planning to start or expand their family. It's important to emphasize that the hormonal effects of alcohol are dose-dependent but can begin even at low or moderate levels of consumption. These effects are often subtle and cumulative, meaning they may not be immediately noticeable, but can significantly impair your health over time. For example, the gradual decline in testosterone can contribute to decreased physical performance, motivation, and mental clarity without obvious symptoms until the changes become more pronounced. Another key point is that hormonal disruption caused by alcohol affects not only physical health but also mental health. Hormones like testosterone, estrogen, and cortisol profoundly influence mood, motivation, anxiety, and depression. When these hormones are out of balance due to alcohol, it can contribute to mood disorders, irritability, and decreased resilience to stress. The interplay between alcohol and hormones also impacts sleep quality, immune function, and metabolic health. Hormonal disruption can worsen sleep problems, impair immune responses, and contribute to metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. From a practical standpoint, understanding alcohol's impact on hormones can guide healthier lifestyle choices. Reducing or eliminating alcohol intake can help restore hormonal balance, improve energy, enhance mood, and support reproductive health. Combined with proper nutrition, exercise, sleep, and stress management, this approach optimizes the hormonal environment necessary for long-term well-being. In conclusion, alcohol disrupts hormonal health by suppressing testosterone, elevating estrogen, increasing cortisol, impairing thyroid function, and interfering with reproductive hormones. These changes contribute to decreased energy, impaired fertility, mood disturbances, metabolic dysfunction, and increased disease risk. The hormonal impact of alcohol is a critical but often underappreciated aspect of its effects on your overall health. Being mindful of this can empower you to make informed decisions about alcohol consumption and prioritize practices that support hormonal balance and vitality. It's a common belief that moderate alcohol consumption, often defined as 1 to 2 drinks per day, is either harmless or even beneficial to health. You've likely heard phrases like a glass of wine a day is good for your heart or moderate drinking is safe. But recent research is challenging these assumptions and revealing that even small amounts of alcohol can have significant negative effects on your brain and body. Understanding this can shift your perspective on what constitutes safe drinking and help you make more informed choices. One of the most striking findings from modern neuroscience and epidemiology is that even low levels of alcohol intake are associated with measurable changes in brain structure. Brain imaging studies using MRI have demonstrated that people who consume even 1 to 2 drinks per week show reductions in gray matter volume. Gray matter contains the cell bodies of neurons and is essential for processing information, memory, and decision making. These subtle reductions, while not immediately obvious, accumulate over time and are linked to declines in cognitive function. This shrinkage is not limited to any specific brain region, but is often observed in critical areas like the prefrontal cortex and hippocampus regions involved in executive functions, impulse control, and memory formation. Reduced volume in these areas correlates with poorer performance on cognitive tasks such as problem solving, attention, and memory recall. The implication is clear. Alcohol, even in small amounts, quietly chips away at the brain's capacity to function at its highest level. Beyond brain structure, even moderate drinking has been shown to increase the risk of several chronic diseases. For example, the relationship between alcohol and cardiovascular health is complex. While some studies suggest small amounts of alcohol may raise good HDL cholesterol, the overall consensus is shifting toward recognizing that alcohol can increase blood pressure, contribute to arrhythmias, irregular heartbeats, and promote inflammation in blood vessels. These factors raise the risk of heart disease and stroke. Alcohol's carcinogenic properties also come into sharper focus at low doses. The World Health Organization classifies alcohol as a Group 1 carcinogen, meaning it is a definite cause of cancer. Even small amounts of alcohol increase the risk of certain cancers, especially breast cancer in women and cancers of the digestive tract. This risk is dose-dependent with no known safe threshold. The mechanisms behind this involve alcohol's metabolism into acetaldehyde, a toxic chemical that damages DNA and interferes with the body's ability to repair genetic material. Another often overlooked aspect is alcohol's impact on the liver, even at moderate consumption levels. The liver is the body's primary detox organ, processing alcohol through enzymatic pathways that generate oxidative stress. While the liver can regenerate, consistent alcohol intake, even in moderate amounts, can lead to fatty liver disease, inflammation, and, in some cases, progression to fibrosis or cirrhosis over years. This gradual damage often occurs silently, without overt symptoms until the liver is severely compromised. In addition to these physical health risks, alcohol influences metabolic health at low doses. It can impair insulin sensitivity, increase fat accumulation, and alter lipid metabolism. These effects contribute to an increased risk of metabolic syndrome, a cluster of conditions including obesity, high blood pressure, and type 2 diabetes, that substantially raises the risk of cardiovascular disease. Perhaps one of the most important but underestimated risks is alcohol's effect on mental health and cognitive performance. Even a single drink can impair reaction time, judgment, and memory, with effects lasting well beyond the period of intoxication. Over time, regular moderate drinking can increase the likelihood of anxiety, depression, and cognitive decline. This is especially concerning as the population ages, since alcohol-related brain changes may accelerate the onset of neurodegenerative diseases like Alzheimer's. From a behavioral standpoint, even small amounts of alcohol can impair sleep quality, which compounds these risks. As mentioned before, alcohol disrupts REM sleep and causes fragmented sleep, leading to daytime fatigue, reduced cognitive function, and mood disturbances. Poor sleep itself is a risk factor for a host of chronic conditions, so alcohol's impact on sleep has downstream effects on overall health. The notion that moderate drinking is safe also ignores individual variability. Genetics, age, sex, and existing health conditions all influence how alcohol affects the body. For example, women metabolize alcohol differently than men and generally have a higher blood alcohol concentration after consuming the same amount, increasing vulnerability to alcohol's toxic effects. Older adults have slower metabolism and are more susceptible to alcohol-related cognitive decline. Genetic factors can predispose some people to greater risks of addiction or organ damage. Moreover, alcohol's interaction with medications and other substances can exacerbate risks. Many common prescription drugs, such as antidepressants, blood thinners, and blood pressure medications, can have dangerous interactions with alcohol, increasing side effects or reducing effectiveness. The cultural acceptance of alcohol often obscures the reality that it is a drug with well-documented risks. The perception of safety around moderate drinking is largely based on historical observational studies that have struggled to account for confounding factors. More recent, rigorous research designs and analyses suggest that the J-shaped curve that once suggested moderate drinking was protective for heart health is likely overstated or invalid. Recognizing that even small amounts of alcohol pose risks doesn't necessarily mean complete abstinence is the only healthy choice for everyone. But it does mean that you should consider these risks seriously, especially if you're consuming alcohol regularly, even in small amounts. Reflecting on why you drink, whether for social connection, stress relief, or habit, can help you weigh these risks against the temporary benefits. In summary, the idea that a little alcohol is harmless or even beneficial is increasingly challenged by scientific evidence. Even small amounts of alcohol are associated with brain shrinkage, increased cancer risk, cardiovascular stress, liver damage, metabolic dysfunction, impaired sleep, and mental health challenges. These effects are subtle and cumulative, but can significantly impact long-term health and cognitive function. Understanding these risks empowers you to make choices that protect your brain and body over a lifetime, whether that means reducing your intake or exploring healthier alternatives for relaxation and social connection. When considering the impact of alcohol on health, it's crucial to look beyond the immediate effects and understand the long-term consequences that accumulate with repeated use. Alcohol is a potent neurotoxin and systemic toxin that, over time, can inflict widespread damage on multiple organ systems, cognitive function, emotional regulation, and overall longevity. The long-term health consequences are often insidious, developing gradually and sometimes silently, but their effects are profound and can be life-altering. One of the most devastating long-term consequences of chronic alcohol use is its impact on brain health. Repeated exposure to alcohol causes progressive structural and functional brain changes. Longitudinal imaging studies reveal that chronic drinkers show significant reductions in overall brain volume, particularly in areas critical for memory, executive function, and emotional regulation, such as the prefrontal cortex, hippocampus, and cerebellum. This atrophy is associated with impairments in decision making, problem-solving, impulse control, and emotional stability. These structural changes contribute to cognitive decline that can manifest as mild cognitive impairment or, in severe cases, progress to alcohol-related dementia. This form of dementia is characterized by deficits in memory, attention, and visuospatial skills. Unlike neurodegenerative diseases such as Alzheimer's, alcohol-related cognitive decline can sometimes improve with sustained abstinence, highlighting the brain's capacity for plasticity and recovery, but the damage can also be irreversible if alcohol use continues unchecked. Beyond cognitive decline, chronic alcohol use increases the risk for neuropsychiatric disorders. Mood disorders, including major depression and anxiety disorders, are significantly more prevalent in individuals with long-term alcohol use. Alcohol disrupts the balance of neurotransmitters and hormones that regulate mood and stress responses, leading to heightened vulnerability to mental health disorders. The relationship between alcohol and mental health is bidirectional. People may drink to self-medicate symptoms of depression or anxiety, but alcohol use itself exacerbates these conditions over time. Physiologically, alcohol exerts toxic effects on nearly every organ system. The liver is particularly vulnerable as it is the primary site of alcohol metabolism. Chronic alcohol use can lead to fatty liver disease, alcoholic hepatitis, fibrosis, and ultimately cirrhosis, a condition where healthy liver tissue is replaced by scar tissue, impairing liver function. Cirrhosis significantly increases the risk of liver failure and liver cancer. Importantly, liver damage from alcohol can progress even in the absence of symptoms until it reaches an advanced stage, which is why early intervention is vital. Alcohol also compromises cardiovascular health. While moderate alcohol consumption was once thought to confer some protection against heart disease, newer research clarifies that chronic alcohol use contributes to hypertension, cardiomyopathy, damage to the heart muscle, arrhythmias, and increased risk of stroke. These cardiovascular risks increase with the amount and duration of alcohol use, and heavy drinking markedly elevates the risk of sudden cardiac death. Another critical long-term consequence is the increased risk of various cancers. Alcohol is classified as a Group 1 carcinogen, meaning it is a confirmed cause of cancer in humans. Chronic alcohol consumption increases the risk of cancers of the mouth, throat, esophagus, liver, breast, and colon. Carcinogenic effects are mediated through several mechanisms, including the metabolism of alcohol to acetaldehyde, a highly toxic and mutagenic compound, as well as alcohol-induced oxidative stress and inflammation, which promote DNA damage and tumor growth. Metabolic health is also impaired by long-term alcohol use. Chronic drinking disrupts glucose metabolism and insulin sensitivity, increasing the risk of developing type 2 diabetes. Alcohol also promotes central adiposity, fat accumulation around the abdomen, which is a significant risk factor for metabolic syndrome, a cluster of conditions that elevate the risk for cardiovascular disease and stroke. The immune system is not spared from alcohol's harmful effects. Chronic alcohol use suppresses immune function, making the body more susceptible to infections such as pneumonia and tuberculosis. This immunosuppression occurs because alcohol impairs the function of immune cells, disrupts the gut barrier, allowing bacterial toxins to enter the bloodstream, and induces systemic inflammation, further compromising health. One particularly concerning long-term consequence is the impact on sleep. Chronic alcohol consumption results in persistent sleep disturbances, including reduced slow-wave and REM sleep, which impairs the brain's restorative processes. Poor sleep contributes to cognitive decline, mood disorders, and metabolic dysfunction, creating a feedback loop that exacerbates alcohol's harmful effects. It's also important to consider the social and behavioral consequences of long-term alcohol use. Chronic drinking is associated with increased risk of accidents, injuries, and impaired judgment, leading to risky behaviors. Alcohol use disorder (AUD), a chronic relapsing condition characterized by compulsive alcohol seeking despite harmful consequences, often develops over time. AUD dramatically reduces quality of life and increases mortality risk. On a positive note, the brain and body demonstrate remarkable capacity for recovery if alcohol use is reduced or stopped. Neuroplasticity allows for partial reversal of brain volume loss and cognitive impairments. Liver tissue can regenerate, and metabolic and immune functions can improve. However, the degree of recovery depends on the duration and extent of prior alcohol use, age, and overall health. Understanding these long-term consequences is essential because it emphasizes that alcohol is not a benign substance. The effects are cumulative and systemic, affecting brain, liver, heart, immune system, metabolism, and mental health. While occasional, low-level use may have less pronounced effects, habitual or heavy drinking inevitably leads to serious health challenges. In sum, alcohol's long-term impact is far-reaching and profound. It damages brain structure and function, increases the risk of mental health disorders and dementia, impairs liver and cardiovascular health, raises cancer risk, disrupts metabolism, and weakens immune defenses. These cumulative effects shorten lifespan and diminish quality of life. Awareness of these risks empowers individuals to make informed choices about alcohol consumption, prioritize prevention, and seek early intervention when necessary.